Good afternoon and welcome to our latest webinar, State of Impact, Hunger in America. Today we will be detailing new Impact Genome AP NORC Center for Public Affairs Research conducted in partnership with the Albertsons Companies Foundation. This important study examines how corporate and philanthropic efforts can be better directed to assist those in need of food and nutrition assistance. Our session today will last approximately 36 minutes. We will be monitoring your questions and answer them toward the end. Everyone registered for the event today will receive a link to the video recording and presentation materials within the next 24 hours. Our panelists for today's discussion include Heather King, Vice President of Evidence and Implementation at Impact Genome, Liz Noble, Director of Evidence and Implementation, also from Impact Genome, and Christy Duncan Anderson, Executive Director and President of Albertsons Companies Foundation. I'll hand things off now to Heather King.
All right, thank you, David, for the introduction. Welcome, everybody. Thank you for joining us. Today, we're going to spend 36 minutes together to talk about hunger in America. So that's going to include the specific challenges we're trying to address, more details on the need for hunger outcomes, the supply of nonprofits addressing the need, and strategies for meeting that demand. And then, as David mentioned, we're going to end with some time for questions. So first, I would like to introduce the Impact Genome Project for those of you that aren't familiar with our work. We innovate ways of standardizing impact data, which allows us to link multiple disparate data sources together so that we can get a clearer picture of needs on the ground and which nonprofits are addressing those needs. Then we use that precision data to help funders and other social impact stakeholders make smarter investments. Some of the ways that we put that into action include on-the-ground needs assessment surveys, like what we're going to discuss today, cost benchmarks that tell us what the true cost of a single outcome is using impact data directly from nonprofits, and a nonprofit registry where we've verified the impact data of thousands of nonprofits. So just so you know, these are things that are available for you guys to use, so please reach out to me or visit our website to learn more about any of those. So this webinar is the third in our Sentinel Outcomes Initiative, which focuses on 6 key social determinants of health, including financial health, social capital, workforce development, education, and housing. So again, see our website for recordings of our previous 2 webinars on financial health and social capital. But today we're going to focus on hunger. And to get us started, I'm going to hand it over to Christy Duncan Anderson, and she's going to share with you why we did this work and what we hope to learn from it.
Thank you so much, and thank you very much for having me. This is really great, and I have been looking forward to this conversation, not just all week, but all month. This is kind of the highlight of my month because this information is so important to us. I work for Albertsons Companies Foundation, and we are the 2nd largest grocery realtor in the US, and with 2,300 stores, and you can see some of our impact there. But what I really want to talk about here is kind of level setting a little bit the definition of hunger and the definition of food insecurity. So hunger is something that is an emotion. It's something that you feel. It's something that it's a very short personal feeling of not having enough to eat at that specific moment. Whereas food insecurity is more about the lack of available financial resources to purchase food needed on the household level. So I kind of wanted to set that in motion because we talk a lot about hunger and we talk a lot about food insecurity. In the US, hunger looks a little bit different than it does in the rest of the world. And I think that talking about those 2 differently also helps us to consider the mindset in how we tackle things like food insecurity in the US. I am very excited to hear some of the results from this research. We have an advisory committee that is the CEOs of some major food insecurity organizations in the US, and they help guide a lot of the work that we do. And we also have a committee of local organizations, nonprofits around the country that also guide what we do. But this work is really important because this is guided by the voices of lived experience. And so I'm very excited to hear what they have to say about that. We take really, I take it very personally, the responsibility for each of those dollars that is donated by our customers at the register to be invested as wisely as humanly possible. And this work helps us to do that. And so I'm very excited to hear what they have to say. And without much further ado, please let us know what you learned.
Yes, for sure. Thank you, Christy. So now we have a little bit of some background why we wanted to do this work. And we're going to go right into talking about the demand or need for the hunger outcomes, and starting with specifically what those outcomes are. So as Christy shared, hunger is complex. It's hunger, it's food security, it's not just one thing. and it needs multiple players. So then that means it's going to need multiple outcomes. And so we found from our synthesis of research and nonprofit impact data that there's actually 7 distinct outcomes in this space. And that ranges from shorter term things like as needed access to meals or regular access to food. Then there's outcomes related to the types of food that are eaten. So that's increased knowledge to sustain healthy eating and healthy food consumption and behavior. There's also systems level outcomes. So that's not focusing on the individual, that's talking about the whole system. And that would be improved food distribution networks and improved availability of foods. And then finally, that ultimate goal, which is food security. So as Christy said, food security is achieved when somebody has that reliable, regular access to healthy and nutritious foods. And that's what the point of all of this is, to get to that much bigger picture goal of making sure that everybody has food security. So what we did is we asked people on the ground, what is your status on some of these outcomes? And we'll get into this a little bit later in the presentation, but we also asked, what would you need to be able to solve these problems specifically? And since we can measure the on-the-ground need, but we don't have a lot of time together, we're just going to focus on the shorter term outcomes that have to do with access to food. So just know that in the NORC report that you guys can see after the presentation, we can send a link to that. There's going to be a lot more information here on more of these outcomes, but again, we're just going to focus in on the one that has to do with the shorter term access to food, since we can't spend all day with you, unfortunately. So in collaboration with NORC at University of Chicago and the Associated Press, with the generous funding from Albertsons Companies Foundation, we surveyed a representative sample of more than 2,200 Americans, and we asked them about their food challenges over the past year. So the way that we're defining food challenges is that they didn't have enough of the foods that they wanted to eat. And we found that 23% of Americans experienced food challenges in the past year. So 37% of adults got food assistance from a nonprofit or a government organization in the past year, which that was a really surprising number to me. That's like almost 1 in 4, or 40%, almost 40% of people were getting some kinds of assistance. And even though they got that assistance, they also experienced barriers. And of those that experienced food challenges, the most common barriers were the belief that they were not eligible for services, they didn't know how to access the services, or they didn't even have a relevant service in their community. So again, this is giving us an idea of the size of the problem and then some of the barriers. And that's kind of the demand side of the equation. So there's also the supply side of the equation, which is what are the services that people are able to access? And in this case, the nonprofits, what are they doing? And what are some of the costs associated with the outcomes that they're producing? So I'm gonna hand that to Liz Noble, and she's gonna walk us through that.
Thanks. So again, as we think about the supply side here, what we really want to understand is what nonprofits are working on and how that aligns with the problems that people are facing. We know that there are many really, really dedicated organizations and programs doing this work and making a difference for people on the ground. But here, what we want to do is take a bird's eye view to understand at a high level whether that capacity is going to meet the level of need. So at Impact Genome, we tackle this by collecting data on outcomes, reach, and budget from nonprofits, both from organizations directly and from the entire IRS tax database. And in doing so, we can calculate a price of impact for each of the outcomes we've defined. So here again, we're going to focus just on these access outcomes, although we do have these numbers for all of them. But these outcomes are where we see a lot of programs and funding happening. And you can see that even within these two outcomes, there's a big difference in cost. For a nonprofit to provide a meal is $8. Sometimes we see even lower numbers than this, but this is looking at the total cost to an organization that's doing the work. And this is also a benchmark across programs. That's to give one person one meal on one day. To provide a person with regular access to food, the price per outcome is higher, which we'd expect. But the point is that we can't treat all of these things as the same, only fund at the lowest level and expect to solve some of these larger problems of food security. Funders need to be thinking about the specific outcomes they want to address within this world of hunger and food security, and then make investment decisions accordingly. So we can also use this information to estimate the cost to meet the national need. We know from the AP NORC study that 23% of Americans reported facing food challenges. That's about 60 million people that need this outcome. At $432 per outcome, it would cost around $26 billion to give all of these people regular access to food. And here's what the current landscape around regular access to food looks like. Nonprofits are running over 2,000 programs that are targeting this specific outcome at a cost of about $1.4 billion total. The gap between that and what we need to solve this problem, the way we're doing it right now, is really big, and that's what you see in this purple circle. What this shows, I think, is one of the issues plaguing the sector right now, and that's the amount of resources flowing into it are not going to solve the problem based on funding alone. We're not going to make that gap up by having every foundation just give more. But using this kind of data, we can make sure that the resources we're putting in are meeting what people need. It's also important to note that this doesn't mean we need to throw everything out and start over. People do need access to meals, immediate access and regular access to food pantries. But what we learned through this work is they also need other types of support as well. So I'm going to hand it back over to Heather to talk more about that.
All right, thanks, Liz. So I'll just reiterate, again, it's really important to us to ask the people on the ground not only what outcomes they need, but also what supports are necessary to meet those needs. So we want to be, again, we want to be sure that those voices are part of the conversation, because that's how this problem is going to be solved. People generally know what they need, and we need to ask them about that and have that be part of the solution. So what we're going to show you on the next slide is from our AP NORC survey, and we asked the representative sample which strategies would be necessary for meeting their family's food needs. And next slide, please. We're going to contrast that with the strategies that are most commonly used in our IGP nonprofit registry. So here on the right are the strategies that people on the ground said they needed, and these are ranked by the percentage of people that said the strategy was necessary for meeting their food challenges. So number one had the most people that said that this was necessary, and then fewer as you go down the list. And then on the left, we have the most common nonprofit strategies, and all of these involve providing short-term access to food, and that includes free meals, the local distribution of food, and food drives. However, those strategies are less frequently cited as necessary by people on the ground. None of those made the top 5, and one of them didn't make the top 10. Instead, people are telling us that they need more money to pay for food, they need different foods in the stores they're already shopping at, and they need reliable transportation. So we're seeing a gap here, and this is food for thought for this sector, unintended. How can funders and nonprofits take these findings into account so that the voices of those that need support are part of crafting the solution? And the power of this approach is that we've translated all of our data into the same language. So that means that we can use something like our impact registry of nonprofits to find organizations that use these strategies. So that helps funders be more targeted with their grants. It helps nonprofits find peers that are using these strategies already, and they can learn from those peers how to incorporate those into their own programs. And so this is the type of precise data that we need as a field to ensure that we're allocating our resources effectively. And I want to reiterate the point that Liz just made too, and it's not that we need to throw out everything that we're doing and start from scratch. I think the field at large is doing really good work, but this data can help us think about how to move forward. So remember again that what we're focusing on for this webinar are these shorter term outcomes. And so that short term need is probably not going to go away anytime soon, but it's not enough to solve the bigger problem. So I'm going to hand it back to Christy, and she's going to talk a bit about how these findings have influenced her thinking as a funder.
That's so interesting that you say that, the field is doing such great work, but there's so much more we can do. The way I think about it is kind of that old, I think it's a social work mindset of, if Heather and I are walking through the forest and we come to a stream and there's a whole bunch of babies in the stream, we can start pulling those babies out of the water, and it feels good and it's absolutely necessary to do. We've got to start pulling those babies out of the water, but the babies are going to continue coming down the water. We're going to continue to have babies in the water. It's a terrible, terrible visual, but it gets the point across. We could continue to pull those babies out of the water, or we could go some of us can continue to, maybe we let Liz continue to pull babies out of the water while Heather and I go upstream and we can fight off that ogre that's throwing the babies in the water, or go to the village and make it policy-wise, make it uncool for the village to have an ogre throwing babies in the water to begin with. I think this work is really important in helping us understand what is needed for not only that work of pulling the babies out of the water, but also going a bit more upstream. And that's what we're looking at as a company, is how we can do that. It's very insightful in the thoughts of trying to become. We're really trying to move towards being an investor rather than being a funder. You know, really trying to invest in organizations and invest in organizations to do a specific outcome rather than pulling the babies out of the water, or giving on a heart-based, although that feels good always, right? Doesn't it? To give on a heart-based. Jason Saul from Mission Measurement, actually, I have a quote on my wall from him that says, I asked him about something. He said, but Christy, do you want to do good, or do you want to do good and feel good about it? So actually, I said that the wrong way. Do you want to feel good, or do you want to do good and feel good about it? So the idea is that I think we have to do these kinds of listening to the voices of lived experience to really start to understand, and that will drive a lot of the way that we think about this and the way that we start to invest. Because one of my greatest fears always is that I'm the one working on all of this, and so listening to these voices of lived experience is very, very important. And looking at that supply and demand equation, I love how you set that up, because I think it's really interesting to see what the demand is and what the supply is that we're giving, and while we still need to pull babies out of the river, I think if you look at this data, and if there wasn't the amazing food network of food banks, et cetera, that are giving these meals, and food pantries and churches, all these great organizations giving these meals, I think that would have moved much higher on the list. I think it speaks to the fact that we're doing a great job of that. And I think that, looking a bit further upstream is what we're thinking about now too. Yeah, so this has been great. Thank you.
Yeah, thank you, Christy. Yeah, it's great to hear your insights as somebody sitting in your seat. And that's part of what we're trying to do is bring all of these voices together, because what you're doing is essential. The voice of the people on the ground is essential. The voice of the nonprofits and what they're doing, all of those things are essential. And what we're doing at Impact Genome Project is creating a common language for us to talk about this. Like things like these standardized outcomes that we talked about earlier in the presentation, like we've defined those. They've been vetted by experts in the field, and then that is a way for us to move past talking about, like, well, what do we mean by food security, or what do we mean by hunger, and just say, this is the outcome that we're talking about. Here's the things that people are doing, and here's what's working or what's not working. Here's how much it costs. Like, those are really the essential pieces of the equation. And I think if we can have a way like this to talk about it, we're going to be able to be a lot more efficient and effective. So thank you. I think we're going to have time for questions now. So we actually have one already. So this is for Christy. So Christy, have you, or how do you plan to change your funding priorities or strategies based on some of this data?
Yeah, it's a good question. I think there's a lot we can change. I think there's no plan, just in case anybody out there is listening and worried. I don't think there's any plan to stop funding some of the work that we're already doing. I think this is an and equation. And I'm thinking about some of the work that we're doing for the holidays, where we're looking at, how can we most efficiently, given, some supply chain issues and other things, how can we most efficiently help families get the food that they need during this holiday season, and quite frankly, capitalize on the generosity of the holiday season to get to further families' food security during this time. And looking at things like distribution of gift cards and other ways that allow families to have the dignity of choice, to choose the foods that they want, and how can we work with our existing partners to do those kinds of things, rather than maybe delivering as many turkeys. Thanksgiving is the one time of the year that no American goes hungry, right? How can, looking at this, I think will really help inform a lot of the work that we do in that area.
Yeah, I mean, that matches up really well with what we found in our study, right? That was the most frequently cited thing as being necessary for individuals on the ground, is that they need more money to pay for food or bills. So I think that's a really nice example of how this way of thinking can connect all of those dots, because now okay, this is what people actually need. This is what they're asking for. You have the ability to provide that. And then we know that we're, those things are aligned, and that's really what we want to get to.
Yeah.
Okay, so we got another question, and it's for me. It says, can you share more about how you connect food needs at the individual and nonprofit level? We already have a lot of data in the area of hunger, so how is this approach different? Well, that's a great question. So I think we've been hitting on it all along, but I'll say it again. Like, one thing that's different about this approach is that we're getting really, really specific. So on that slide where we had all the outcomes, we had a whole range of things. It's not just food security. It was a lot of stuff that would, has to kind of come before that. So the short-term access to food, that one meal on one day, the long-term access to food, which we're defining as like, a more regular ability to get food that's not just like a one-off. Then we had the quality of the food that you're actually eating. So those were the nutrition, knowledge, and behavior outcomes. The systems level outcomes, like how is food being moved around? How, who's being able to do that, and how is that being supported? And then we have food security. So that's one thing that we see as being really different about our approach, is that we're getting really, really specific. And I think we've seen throughout the presentation so far how that's useful, because we can talk very specifically about a single outcome, and then we can tie that to the strategies that nonprofits might be using and things that funders are supporting. So that's the second part of that, is, again, because we can translate everything into the same language, we have ways of, for example, if a funder wants to support other programs that are providing money for food or bills because they want to, follow what we found in our survey, we have ways of doing that. We have ways of finding those nonprofits because we take in their data and we actually vet it, and we ask them, what strategies are you using? And so again, all of that can talk to each other, and so we can make those connections much more easily because we have this common language for addressing all of this. Okay. So Liz, can you talk more about how that benchmark of $432 breaks down? So is that the duration of access to food for the rest of that person's life? Like what is that actually telling us?
Yeah, that's a great question. So that typically when we look at programs, we're asking for their program cycle, and regular access we're defining as overtime at least 1 month. So I think, depending on the program cycle or how they're reporting, it might differ slightly, but really what we're getting at there is the cost to give someone food over at least the course of a month. That's going to be more regular than, say, going to a soup kitchen or getting food, just once in a while. Some of it also has to do with how programs report data. So if they're looking at how many people are they serving over time, rather than what some programs report, which is how much food are they getting out the door, and they're not tracking how many families that's going to. So this regular access is capturing that someone is getting that food over time. And we also saw in the AP NORC survey, we asked about how long people thought they'd need assistance for if they were struggling with food challenges. And it was only about 2 in 10 people that thought they'd need assistance for less than 3 months. So I think that also sort of underscores the need for this sort of larger scale solution. There are going to be those more immediate needs, and those aren't necessarily going to go away, but we don't want to necessarily rely on very short-term solutions to solve what's really a long-term problem for people. So I think understanding that sort of underscores the importance of this regular access and distinguishing it from as-needed access, because those are two really different things that programs are providing, not necessarily one more important than another. If someone needs a meal right now, they need a meal right now, and that's really critical, right? And if someone needs to have regular access to food over time, they're not going to necessarily get that by going to a soup kitchen every day for the rest of their life.
Yeah.
Can I ask a question? Does that also include connection to some of the federal meals programs like SNAP or WIC, or would that be included in that too?
Yep, we consider those as part of that regular access because they're giving people a means by which to improve their access over time to larger amounts of food. So even something like a school lunch program, it's going to an individual child, but it's supporting the family's ability to feed their family over time.
Sure.
Well, that's actually another really good point, Liz, about the outcomes measurement piece. And that's actually something that we do talk with nonprofits and funders about quite a bit is the evaluation of their programs. And so that is sometimes an area where nonprofits could maybe use support. Like there might be systems that they can put in place to better measure, well, how many like unique visitors am I getting to my food pantry versus, you know, I'm just looking at here's the number of meals or here's the number of boxes of food I'm handing out. And then that might actually give us a better sense of like what the impact is for how many people, and that can better even inform the benchmark and, you know, all these other metrics that we're collecting. So that's just another thing to think about. I mean, this is all very complex, but this is why we need to be talking about it in this way, because we can then say, okay, we know that as needed access to meals means this, and if we want to move to more regular access, we know what that means, and we can better help nonprofits measure that so that we can have a more accurate picture of what's going on. Okay, so here's another question. What metrics can companies use to track impact in this space beyond dollars and the number of meals donated? So we actually just kind of talked about that. But Christiane, are there any other things that you guys track?
You know, I think that's a great question, and something that we are wrestling with on a daily basis. And if anybody has any great ideas there, please don't hesitate to reach out. We're looking at, can we track things like moving people out of food insecurity? Can we track, how can we track that? Can we, and then what do we do about bounce backs and things like that? But, you know, can we track that? Can we track it from a global scale? Can we look at, you know, the total food insecurity metrics and then see how those change over time and how our funding in certain specific areas may have made a difference there, and or can we work with the organizations that we work with to have self-reported change within that metric as well. But yeah, that's the golden question, isn't it? How can we get beyond just tracking meals and amount given, because those are so easy to track comparatively. These other things are much harder to look at and to track, and you know, looking at that investor mindset of how can we start to purchase those outcomes? How can I start to say that this, you know, we're looking for this outcome, and what kind of cost per outcome can organizations provide to us looking for it?
Yeah, that's helpful. And I think just calling back again to those standardized outcomes, like those are also things that we can track, right? And again, this is feeding into that common language idea. Because if all we're looking at is the dollars and the number of meals, I think we've just laid out for you all that is probably not quite enough to really solve the problem. So we do need to be tracking other things. And again, those outcomes are coming from the academic research, from nonprofits themselves, and we're essentially reflecting back to the field all of the things that they're doing and what they're measuring. So that's why we're doing that, so that we can have better conversations like this.
Mm-hmm. And I think you, sorry to interrupt, but I think you make a very good point there, that that shared language is so important for all of us to be able to use that language, and what is measured happens. So I think for myself anyway, I feel like I have a responsibility to move beyond amount of money donated and even beyond meals in some cases, although I'm never going to get rid of counting meals, I'm sure. But you know, there's a responsibility to not just say we donated this much money, but to actually say what was the impact with those funds too. Yeah, good point.
I think too, sorry Heather, there's, you know, when on the ground, you know, programs and nonprofits are enabled or supported to do more sophisticated evaluations, right? When they're able to better track what they're doing, and then you can aggregate that up using something like these standardized outcomes, then the funders are enabled to say, we know that all of this measurement they were doing on the ground that we might not be able to do ladders up into this outcome, and we can more richly represent, alongside these other metrics that are easier to collect, you know, we can more richly represent not just how many meals, but the sort of nutritional quality and healthy, you know, how many healthy meals, or whether that was changing, whether people were enabled to eat in healthier ways over time, or knew how to, you know, they can start to get at some of these more, you know, just round out that picture with these other outcomes a little more.
Yeah. Okay, great. So we got another question here. So was this research done before or after the monthly child tax credit, which boasts pulling millions of children out of poverty? And if it was done before, do you think this program that may or may not continue will change what people identify as their first need of needing more money for food? So that's a great question. We ran this survey, it was July and August of this year, and we asked about the prior year. So I think that child tax credit was happening. And I think it's still happening, right? I think people are still getting that. So I think that's really interesting, actually, because there's still, you know, there's money going to families, and yet people are still asking for money to pay for food and bills. So, you know, if that program doesn't continue, I mean, I don't think that bodes super well for this overall picture, right? If it goes away, I think that could potentially exacerbate that top need that people are citing. Okay. So Liz, I got another question for you. So we've been talking about access, but do we have any information in front of us right now about the outcomes that are more focused on healthy eating? So somebody's saying that they do see a lot of those types of programs requesting financial support. So I'm wondering if we have any information on those.
Yeah, yes, we do. And also just another reminder that the full report is available on the AP NORC website, and we can share that because there's more of that data in there. So just as a reminder, we have two outcomes there. One is focused on increased knowledge to sustain healthy eating, and the other is looking at food consumption and behaviors, which includes shopping for and cooking healthy foods. So one thing we found is that about a third of Americans said they struggle with knowing which foods are healthy when they shop, how to plan and prepare nutritious meals, and that they're uncertain about what they need in order to be healthy. And people facing food challenges are less confident about knowing how to be healthy and get nutritious food on the table. Another thing we saw, I think that's relevant to this, is that we saw about 13% of Americans reporting that they regularly shop at convenience stores. That's somewhere around 30 million people. We also saw that people who regularly shop at convenience stores are less likely to regularly buy and eat healthy foods than those who are rarely or never shopping there. So that's, I think, pointing to something as well. We see in our data less programs focusing on these healthy food knowledge and behavior outcomes, or reporting outcomes in those areas, which may be connected to the conversation we were just having. So again, that's not to say they don't exist, but that there's still a gap, I think, between the level of need we see with relation to that and what's currently available or accessible.
Yeah, I think that does get back to the measurement question for nonprofits too, of what is easy to measure. And I think a lot of programs can probably tie what they're doing, even if it's providing short-term access to food, they can tie that to healthy eating and, you know, nutritious food consumption. But if it's really hard for them to measure that as an outcome, then we are probably not going to hear about that as an outcome. And then that's not going to get included in this bigger picture. And so I think that, again, reiterates this need for supporting nonprofits to better measure their outcomes and to have these solid definitions of what does it take to meet that outcome. Because sometimes that's the hard part too, is like, well, okay, we think that they're eating healthy. We think that we're giving them nutritious food. But if there's not a great way to measure that or a great definition for what that means, I think that just makes the conversation harder. So that's another good point. So getting a few more questions. Let's see, so Feeding America and many others cite the cost of a meal at less than $4. So how do we justify twice that in our price of impact slides? So,
You want me to take that one, Heather, or you want to talk about it?
yeah.
Okay. So I think we've talked about this a little bit, and potentially there's a few reasons. So first, the cost of a meal itself might be different depending on the location, whether it's prepared food or not prepared. Sometimes those numbers might be referring, again, to the cost per poundage of food delivered to a food bank, rather than the cost to get a meal into the hands of someone who's hungry. So that $8 number is an average across organizations of the total cost to do the work they need to do to get a meal to someone. So it includes overhead, but it's also an average. And so we know that some programs may need more than that, and also that some will do it for less.
And there's a methodology difference too, right? I mean, you're talking about the full cost to it, right? Which is what you mentioned. You know, it's I think 10 cents is something that I hear often, and I think that I don't think anybody actually thinks it only costs 10 cents to get food to somebody, but I think that we're kind of comparing apples and oranges here a little bit. But it is interesting to look at. Basically what you did is take the entire cost of the program and divide the number of meals that is reported by the entire cost of the program to come up with the average cost per meal. And it's interesting and important to look at that, I think, and interesting and important to look at both metrics too. You have to kind of weigh them both.
Yeah. Great, thank you guys. So we're actually right at time. So we made it to 36 minutes. So thanks everybody, really, thank you for joining us. And we're gonna be following up with a link to the recording and then links to that NORC report and the AP story. And keep an eye out for our next briefing, which is gonna be on housing and homelessness. It's gonna be sometime this winter. And if you'd like to get more involved, please reach out to me about joining our consortium if you're a nonprofit or funder. If you have any other questions for us, don't ever hesitate to reach out. We're more than happy to chat. And thanks again for coming with us on this journey. Thanks.